Hey, Assalamu alaikum, everyone. Thank you so much to all of you for joining today. It's a pleasure to have you on this webinar. It's going to be all about oral health today, an area that's often overlooked in healthcare, but so very important. And we're going to learn all about it today from Dr. Zainab Naeem. Zainabin is a doctor, is originally a dentist, originally from Canada. She did all of her training at McGill University and now practices general dentistry in Pennsylvania. She looks after people of all ages and also um, deals with people with disabilities in the OR as well. So I'm delighted to introduce her today. And without further ado, I'm going to hand over to her. Welcome, Zainabin.
Shukran. Thank you, Fatima Ben. Kamsa Sagla, how are you everybody doing? Jill, so I know it's everybody, I appreciate everyone for being here so late in the evening. So we can just get started. Okay, Bismillahirrahmanirrahim. So oral health, why it matters. Okay, so like Fatima Ben said, my name is Dr. Zainab Naeem. My maiden name is Abdul Hussain, if anybody knows. Those of you who don't know. All right. So a little bit about me, if this wants to. Oh, okay. Health on adults and children, or oral health and overall health, and of course Muhammad and its effects on the oral cavity. So, naswa. So this is like a hadith. Actually, it's nazahu tariq al Quran. It's his Quran rasta ne saaf karo. So that's why it's essentially why it's so important, especially. So oral hygiene. Can you hear me? Okay, Fatima Ben?
I think it had skipped a little bit, but just keep going and then I'll let you know. I think it seems to have corrected.
Okay. So the importance of oral hygiene. So good oral hygiene prevents cavities, gum disease, bad breath, tooth loss, and of course it maintains your overall health. For those of you who don't know, and I'll go into that quite a bit. So these are 10 easy habits for oral health. Using fluoride toothpaste, scraping your tongue, especially healthy diet, all that. Okay, so poor oral hygiene. Why? What does it happen when you have poor oral hygiene? So it leads to plaque buildup, decayed teeth, gum inflammation, gingivitis, gum disease, which is periodontitis. So these are 10 signs of poor oral hygiene. So if you have persistent bad breath, bleeding gums, and you're flossing or brushing, so don't think that, oh, I'm not going to floss anymore because my gums are bleeding. No, they're bleeding because you don't floss. And I know you hear the dentist say that, but it's true. Just take my word for it. Floss for like 2 weeks straight, and then you will see an improvement in your the bleeding of the gums. And flossing correctly. We'll go over that. So your teeth are stained or yellow, your gums are receding, you have a toothache that won't go away, you have tartar around the gum line, you have white splotches on the teeth, which is essentially the demineralization of the enamel, which is the outer surface of your teeth, and your tooth is sensitive to hot or cold, which can like further intervention in your teeth. If your teeth are loose, or your bite feels different, or you have a dry mouth. So how do we prevent this? Good oral hygiene, of course. So let's talk about what all these topics are we covered. So gingivitis, the early stage of gum disease. So look, this is a kind of a graphic. I think it helps. So you can see healthy gums versus what gingivitis gums are bleeding. They're swollen. But the good news is reversible with proper oral hygiene and cleanings. So, and especially with flossing. And it can also, you can have bad breath with it as well. So here is a little diagram of going from healthy gums to gingivitis to periodontitis, which is not reversible, to advanced periodontitis, which is close to severe and you can lead to tooth loss and all of that. Okay. So I can just leave that there for a few seconds and then we can go forward. And we're going to talk about periodontitis. So periodontitis, it's advanced gum disease and it causes bone loss. Like I said, here's a little graphic you can look at while I talk. So what happens? The inflammation in your gums that we talked about for gingivitis, it spreads below the gum level towards the bone, and the bone that's supporting your teeth, as you can see here, it starts to get destroyed, which is and then no longer
Sorry, Zainabin,
supporting the tooth around
you're
it, causing the tooth and more and
Zainabin, we can't hear you
causing
properly.
deeper pocket. in your gums, which is causing food debris, plaque, tartar, all to kind of, oh goodness, okay. Can you hear me now?
Yes.
Let me try
S- So from the
to,
start of the slide, we
let's
couldn't really
see.
hear much.
Is everything okay now? Oops.
Uh,
Sorry about that.
that's
Is
okay.
everything okay now?
I think so, yeah. I think that's better.
Yeah. So
It just
essentially what this graphic
periodically,
is saying, it causes tooth loss. It cuts out. Okay, let me see if I can join from my phone. It might be better. And I can rejoin from my phone, and I'm not sure how to let's see. Can you hear me now?
so
Maybe
there's
not.
periods where
Let's
we
see.
can hear you and then it just kind of cuts off suddenly
It cuts out.
and then speeds up. Yeah.
Okay. Sorry about that. I'm not
That's
sure what's
okay.
going on. Uh, let's check. Well, it's essentially what's in the slide. Um, it is pretty severe, and it's also linked with diabetes, which I'll talk about later on as well. Did we hear that okay?
Yes.
Okay. So essentially, the bones supporting the teeth are destroyed, and your tooth becomes loose, and you have a deeper pocket in your gums because the bone is receding, and the food debris is getting caught in, and there's more plaque being built and causing more inflammation in the whole process, and the process just get worse. And the only way to kind of treat this is at the dentist. So another thing that happens when we have poor oral hygiene, tooth decay. Are we good on sound? Let's
Yes.
see.
Yes, yes.
Okay, great. So these are some of the stages of tooth decay. So we have the healthy tooth here, the cavity begins to form, and then you continue. If you don't treat that cavity, it continues and continues until it goes to your pulp, which is the nerve of your tooth. That's when you start to feel that hot and cold pain that wakes you up at night. You don't know what to do, and it's bad and an abscess forms. And the only way to treat this is either with a root canal, or sometimes the tooth is so far gone it needs to be extracted. So risk factors for this are frequent snacking, sugary drinks, poor oral hygiene, and a dry mouth. So what is the decay process exactly? We can talk a bit about that. I won't bore you too much of the details, but it's essentially when you're eating a lot, when you eat a lot, snack a lot, the sugars in your mouth, the bacteria in your mouth feed on that sugar, and that bacteria causes acidic environment, and the acid is what breaks down your teeth, and that's how the cavity forms. Okay. So let's talk about how we can prevent this is with good oral hygiene and proper hygiene techniques. So what is a good brushing technique? So let's talk about it. So you brush twice daily for 2 minutes. I know it feels like a long time, but it will make a difference. And when you start doing it for 2 minutes, after you don't do it for 2 minutes, you'll feel a difference. So please use a soft bristled toothbrush. It's very important. I know it can seem counterintuitive that you think I have to use a hard bristle toothbrush. The hard bristles actually will cause more harm than good, and it's not good for you. So please use something that says soft, and you'll see it on the label. So hold the brush at a 45-degree angle, kind of like this, and then you're brushing like that, like kind of like that. Okay, and be gentle, but make sure you get all the surfaces of your teeth. So the outer, the sides, beside your cheeks, by your tongue right here, and all along your lips and below your lip, right there. It's hard. Sometimes you can miss it. Okay, and your tongue especially is very important, and of course the chewing surfaces. So right there. Okay. So replace your brush every 3 months and use a toothpaste with fluoride in it, please. Also avoid aggressive brushing. Can you hear me, Fatima Ben? Is it cutting off again?
No, we can hear you.
Are we good?
Yes, we're good.
All right, great. So, and please avoid aggressive brushing, which includes using a hard bristle toothbrush. Also, I highly recommend an electric toothbrush. I know it can seem pricey a little bit, but there's so many options. You can check Amazon, Walmart, wherever. They're really worth it, and I really think they make a difference. A lot of them have built-in timers, which is helpful, okay? So, if flossing, I know this is a lot of people don't want to floss, and I understand it can be tedious, but it's very, very, very important. So, floss once daily at least. And especially when you're flossing, do it before you brush. It loosens the debris between your teeth, and when you brush it, it all goes away at the same time. So use about 18 inches, which is like I would say from your fingertips, from like to your elbow about. So you wrap it around your finger and you glide it between your teeth in a C shape. So I've included a diagram here, as you can see. This person is putting it below her gums. Do it gently in like a C shape around your tooth. I don't know if you why do I have to floss? Like, doctor, why do I have to floss? I don't want to floss. It's so annoying. Okay, well, it removes the plaque between your teeth. It prevents the cavities between the teeth, and it's the brush. It won't get there. Your toothbrush can't get between your teeth. It's not possible, and the plaque will build up. And I've most of the cavities I see that people they have great teeth all around, but in the X-ray you see little cavities starting in between the teeth, and the only way to stop them, or to stop them getting worse, is to floss. Okay, and also prevents gum disease, of course, because you're treating the gums. So the importance of a regular checkup. I know it's like it's easy to just forget about your teeth, and like unless something's hurting or it's an emergency, then you're like, oh, I remember my tooth again. Then you go, but it's really important to go regularly. It detects cavities early before they become painful, because once they become painful, that's pretty much you'll need either a very large filling or a root canal or an extraction. So we want to prevent that, and that's also very costly. So identify early signs of gum disease. So let's say you're starting to get gum disease and you don't know, but if you go for a checkup, they can catch it early on and they can stop it in its tracks and stabilize that. Because unfortunately, like, you can't grow the bone back. I mean, without surgery, but it can help stop that process and you can save your teeth. So it also screens for oral cancer. I do oral cancer screenings all day, every day during my checkups. We monitor for tooth wear, grinding, and jaw issues. So that's very helpful, especially if you have jaw pain. It can be because of your grinding. Um, Remove your plaque and tartar buildup that brushing can't remove. So this is what the image is showing. I apologize. It's probably kind of gross after dinner or before, whatever, whenever you eat. But this is tartar buildup or a calculus, and it's not possible to remove with a toothbrush or a floss. You need the ultrasonic scaler that we have, that one that has like water squirting out of it and kind of vibrates. If you had a cleaning before, you know what I'm talking about. And it does a great job of cleaning up between the gums. Okay. So, and also, like I said, it prevents costly and complex treatments later on. So, how often should you visit? So, you should come see me every 6 months, if you're, or as I recommend, or as your dentist recommends. And children start from age 1 every 6 months, unless you need other intervention. Also, if you're a high risk patient, for example, you have diabetes, you're pregnant, or you have high blood pressure, or other issues, or otherwise recommended, or you have periodontitis, especially, it's every 3 to 4 months. Okay. So let's talk about children's oral health. I have a lot of questions about this, often from parents, and it's hard. You're confusing. Even myself. I was in my about me, but I don't. I think the slide didn't load. But I'm a new mom to a sweet baby boy, and even I am doubting my own self. I'm like, wait, this is exactly what I do. So I have firsthand experience on this, so I understand. So let's talk about the teeth eruption sequence. I won't bore you too much of it, but essentially, you're looking at the first tooth between 6 to 12 months of age. It's okay if it happens later. We're mostly looking at the sequence of eruptions rather than the timing. At 3 years, you should mostly you have all your baby teeth, and then at 6 years, you get your first adult tooth. It's the molar in the back. And between 12 to 14 years of age, most permanent teeth have erupted. So we really need to ramp up oral hygiene at that point too, but we should do it from the beginning, absolutely. So when should you do the first dental visit? Like I mentioned, so after the first tooth comes in or by 1 years old. So this is kind of a little technique that we do often with the kids. A lot of them too small, or they're scared, or they kind of just need to see what's going on. So we do the knee to knee technique. Okay. All right. So why baby teeth? It's like, oh, ato chala jasa teeth. We don't need them. Oh, they'll fall out. We'll get new ones. It's fine. But they're actually very important. Oh, sorry, very important for your adult teeth and in general for childhood. So they hold space for your permanent teeth, and that's a huge thing. They help speech and development. They help with chewing, nutrition. They guide your permanent teeth into eruption. Sorry about this scary X-ray. So this is what a 6-year-old's jaw often looks like. Um, you have all the adult teeth kind of erupting at the bottom and all the baby teeth at the top. and you have the adult molar right here. It's already grown in. So as I'm saying, it guides the permanent teeth in. And if you don't have space for it, the teeth kind of, lean onto each other, and the adult tooth gets blocked and it can't. It supports facial development and also for socialization or growth, or they're being made fun of, or they don't have teeth because all their teeth are being, extracted because they're by 3 years old, they need all their teeth out. And that's all of their baby teeth that they're not going to have those teeth replaced with their adult teeth for quite a few years. So it can be pretty traumatic. So early tooth loss can also lead to crowding and misalignment, like I said, orthodontic issues, and also a narrow airway, which is cause breathing, sleep apnea, and all these things. Okay, so it is very important to take care of the baby teeth and primary teeth, or as some call them, milk teeth. Tips for cleaning your child's teeth. So this is very great graphic right here. So before your baby has teeth, use a soft cloth or like an infant toothbrush and just wipe their mouth inside before they go to sleep. After teeth are rubbed, use a small little toothbrush. You can get the little baby toothbrushes or soft bristle ones. Brush twice. Parents should not allow their child to brush alone until they're age 9. I know it's difficult. I know that we're all busy. I know it's hard, but it's really important. And just tell them to brush with you. Brush before. It's good for you too. You're brushing more too. So, and also start flossing early. Start creating that habit because it's difficult to start as they get older. Please use a fluoridated toothpaste. I know there's some scary videos out there about fluoride. I hope you haven't seen them. If you have, I'm here to debunk that. Infants and toddlers, please use a rice size amount of toothpaste. This is kind of an image of what that means. It's a little tiny bit, and just on their little teeth, you can just rub it with your toothbrush. And for 3 to 6 years old, a pea size amount. Okay. Any let's see. And if we have any questions, you can just put them in the chat, and Dr. Fatima will let me know. Tips for making brushing easier. So I know I'm talking about you need to brush your kids' teeth, but let me give you some tips on how to do that. So here are some helpful strategies. Just make it fun. Um, Use songs or little timers. Let them choose their toothbrush. That gets them excited too. Brush together. Like I said, children always copy their parents. Oops, sorry. And then use a lifting lip technique. It's shown here on this image. It helps clean near the gum's early cavities, because most of the cavities I see in kids have been right above the gum line. It's like they're brushing, their teeth are clean here, but right above there's heavy plaque all deposited there because they're not brushing there, and they have cavities all underneath that plaque. So please, and even adults, a lot of adults forget that area too. So positioning tips for parents. For babies and toddlers, so this is actually a really great technique as your child gets older. So it's called the child lying on your lap technique, where you kind of hold their arms down with your legs to if they're bothering you, or if they're kind of pulling the brush away. And it's not scary; they're fine. It's much more traumatizing for them to have all their teeth pulled out than having brushing like this for 2 minutes a day. And you can make it fun too, like a game. So there's this knee to knee position. We can talk more about that later. And then standing behind your child with their head lifted back. So they allow better visibility for you and control of your the brushing. Okay. So let's talk about the key takeaways of children. So we brush twice a day, we use some food, and please take your child to the dentist by age 1 and with continued care. Okay. And they also help them get acclimated to dentists. So we don't have dental anxiety as they get older because they're used to it, and it also helps a lot for you too. It causes you less stress as well once you need to take your kid to the dentist for something. So oral health versus overall health. How does it impact our overall health? So oral health is a window to your overall health. Oral bacteria can enter your bloodstream, can cause inflammation, and affect major organs. Poor oral health is linked to heart disease, diabetes, stroke, high blood pressure, pregnancy, and complications. Okay. And please, if you have any health issues, it's very important to inform your dentist. I know it may seem like, oh, why do you need to tell? You're just working on my tooth. Like a lot of it, your whole body is connected. Your mouth is a part of your body. So we do need to know if something else is going on, especially with, heart disease, high blood pressure, because it affects how much anesthesia we can give you, all that. Okay. And diabetes is a huge one. We're going to talk about that. We're going to cover that. Okay. And here's a little graphic about showing, and of course, poor oral health also has risk of cancer, and when you're pregnant, premature birth. So we'll talk all about that. So let's talk about diabetes. So these are 5 common oral health problems with diabetes. So tooth decay, dry mouth, fungal infections, it's called thrush or Candida, gum disease, like I talked about periodontitis, and delayed healing. So because of the high glycemic index and all that, but I won't bore you with all the details. So gum disease can make diabetes harder to control. It's the inflammation loop, which means your body is inflamed from the high blaming each other, and it's just a bad situation. So it's very important to be followed by your dentist if you have diabetes, especially, and you have a weakened immunity because of it, and it increases further complications such as kidney disease. So the key management is with medication, lifestyle, following with your primary care provider, and dental care, regular comprehensive evaluations every 3 to 6 months. So, effective treatment of gum disease can also significantly improve your blood sugar levels, and multiple studies have shown, and it's been on the American Diabetic Association as well. So, let's talk about pregnancy and oral health. So, pregnancy increases the risk of gingivitis by 60 to 75%. Okay. Poor oral health is an important part of prenatal care. Oral health is an important part of prenatal care, but and poor oral health during pregnancy can lead to poor health outcomes for both the mother and the baby. So it's very important. Um, so essentially, when you're pregnant, you can go to the dentist. It's okay. It's especially encouraged in the second trimester, which is when you're about 4 to 6 weeks, 4 to 6 months pregnant. So why does this happen? A lot of hormonal changes are happening. You're swollen. You have a much higher vascular supply in your body to support your baby. So a lot of that can cause swelling, and that swelling can also go to your gums. You also have higher acidity. A lot of times you can have morning sickness, and that can cause tooth erosion and decay. And untreated gum disease is linked to premature birth and low birth weight. So it's very important. So pregnancy and oral health. So let's talk about how to manage this. So good oral hygiene, regular checkups. You're allowed to get cleanings. It's fine. You don't like we try to delay unless it's like essential treatment, we delay it until after the baby. But if you need treatment, we do it in the second trimester or between 4 to 6 months, and that's fine. So please inform your dentist if you're pregnant. It's very important. Treat dental infections immediately. Severe infections may impact your pregnancy. Also, flossing is very essential during pregnancy, even if it's uncomfortable. I've seen multiple pregnant women, they lose their teeth, and because of so many factors, so it's preventable a lot of the time. So it's very important to brush twice a day with soft bristles, like I said, or we already discussed this, and I'll just repeat it again because it's important. And please use a fluoridated toothpaste. So let's say, I know it's very gross when you feel after you vomit, but regardless if you vomit, whether you're pregnant or you just vomit because you're sick, do not brush for at least 30 minutes. Instead, rinse with 1 cup of water and 1 teaspoon of baking soda to neutralize the acid in your mouth, and it prevents the acidic attack on the enamel, which often causes the decay and the erosion that we often see. So let's talk about Muharramat. So Mola Ganu Farmache, and this is also a huge link not only to your body, your social life, but also to your oral health. Okay, so alcohol and oral health. Significant harm to the oral cavity. It causes dry mouth, enamel erosion, tooth decay, staining, and increased risk of periodontal disease. Um, and also, of course, cancer. It is a class 1 carcinogen, which means it is directly linked to cancer, causing cancer, and also it increases the risk of cancer by 40%. Okay, okay, so tobacco. So let's talk about smoking tobacco. It causes 90% of oral cancer. It causes 90%. It's not correlated with. It means it causes it. It means it's directly. You do this 90% of the time, this will happen. Smokers have 5 to 10 times higher risk of developing cancer. And when you combine alcohol consumption with tobacco use, this risk increased by 30%. So I'm sure we have mathematicians here, and it's a significant detrimental risk. So it also, with tobacco, you have bad breath in the oral cavity, staining, gum disease, and like I said, cancer. So marijuana use, it's a lot of the cannabis smoke contains many of the same carcinogens as tobacco. So with marijuana, what happens to the oral health? You have fast heart rate anxiety, you have increased bleeding, which causes gingivitis, bleeding gums, higher incidence of cavities due to your dry mouth. You have mental confusion, lack of focus, oral cancer, of course, and the staining and the discoloration. So vaping, very similar situation, dry mouth, oral cancer, kind of the same thing. It all kind of leads, to the worst case scenario, cancer. which is more happens more often than not, and also affect all the body, all the effects on the body itself, and not only the oral cavity, right? And then cut, it causes periodontal disease, dry mouth, tooth decay, or like kata edulus, which is the English term for it. TMJ disorders from all the chewing, oral cancer risks, of course, and often it's used with chewing tobacco, which is compounding the damage to the oral and systemic health. So that kind of concludes my presentation. So essentially, I'm talking about, oral health and systemic health and how that all combines. So this is kind of a graphic that pulls it all together. And then we have oral health. And then just to summarize, oral health is directly linked to our overall health. We use it to smile, chew, eat, socialize, and, we need it. So it's very important. And thank you very much. And if you'd like to contact me, here's my email. Thanks.
Thank you very much, Zainab.
If
That was
anybody has any
really
questions, you can let
interesting
me
and
touch.
eye-opening, actually. If anyone has any questions, please feel free to unmute or just pop them in the chat box. Um, I think we're all going to be kind of booking those dental appointments after this.
Glad to hear it.
So I have a question actually, with regards to
Just pull that
the
graphic up so we can kind of take a look at it.
yeah, with regards to the toothbrushes, um, so I know you said the electric toothbrushes are better. Is it mostly because of the fact that it has the timers and the pressure and things and the way that it brushes, or are there any other reasons as to why it's preferred?
So that's a great question. It essentially puts the right amount of pressure, like you said. It also, some of them have like a sensor that stop you from putting too much pressure on polisher at the same time. So sometimes you also has consistent pressure all on each every surface of your tooth. So sometimes you'll be brushing harder here, softer here with a manual toothbrush, but with the electric toothbrush, it'll have like a consistent, pressure everywhere that's kind of stabilized all along your mouth. So that also is something that helps with it. But that's a great question.
And what about with the like when you go to buy brushes, I know you said that it always picked the soft bristles, but is there any
Mhm.
circumstance where you'd want to like get a hard bristle or the medium bristles? Because like there's always multiple options for those.
So that's a great question as well. So absolutely, I would never recommend a hard bristle toothbrush. It definitely causes more harm than good. And the job that the soft bristle toothbrush does is basically what you need essentially for maintaining your oral health. It also is much softer on the enamel. Often when we brush, we have a more acidic environment in our mouth as well, and the hard bristle kind of causes more erosion to our teeth as well. It kind of expedites that. So I don't really recommend it.
Amazing. Thank you. Okay. So if you're okay to just hang around for some questions and as we get them going. It's So I do a lot of
Okay.
women's health and things like that too. And it is something that's really
I know it was
neglected,
a
I
lot of
feel.
information, buddy. Sorry.
No, it was very useful actually.
Mhm. Yeah.
So I was just saying, like, in pregnancy and things, healthcare, like oral health is really neglected, and often people feel I'll just delay it because I can't get anything
Mhm.
done to my teeth because I can't get x-rays. So
Yeah.
there are a lot of myths around that too. Um,
Mhm. Yeah, no, x-rays are as long as we're doing it like for to check what's going on, x-rays are completely safe. We're not going to start blasting a bunch of x-rays on a pregnant lady for no reason, but like if she has like an area of issue of pain, we're going to check with an x-ray because that's the only way to definitively diagnose and also give her the best gold standard care. But yeah, definitely, I mean, I'm sure with patients, I'm sure they may ask you as well, so this is something you can definitely let them know that if they need to,
Absolutely.
then they can.
Absolutely. We have a question in the chat box. The question is wisdom teeth extraction always required?
Mhm.
And after how many days should one resume regular food?
So, great question. So regarding wisdom teeth, so I pretty much always recommend them being extracted. More often than not, they've always caused more harm than good I've seen. They are very difficult to keep clean. They often cause secondary decay because they're decayed, and then they transfer that bacterial decay to the tooth, to the neighboring teeth. So yes, I always recommend it pretty much, unless like you have like pristine oral hygiene, you have enough space in your mouth and you're able to, you're just, adamant on keeping them. I won't force you. I won't force anybody to remove their wisdom teeth, but I always recommend it if I feel like, it's going to cause more harm than good, which is more often than not. And after how many days you can eat right away, but just follow your oral surgeon's instructions. They'll give you a whole instruction pamphlet on what to do. Often you cannot drink from straw because you don't want to remove that blood clot that's developing and cause something called dry socket, which if anybody's experienced it, they know it's extremely painful, a post-tooth extraction. And just eat soft foods that you don't have open. Don't eat anything too hard, like any chevro or something like that to like open your sutures. Foods the first few days, I would say the first week, and then you can resume as swelling goes down. You can resume, and also avoid hot, spicy foods. I know that's a common food group, but avoid that for the couple days. But good question, thank you. I know it was a lot of information for everybody to kind of digest, so Um, I can put my email back here if anybody would like it.
Yeah, I think
Excuse me.
I think it was useful to have all the information. I know there was a lot, but I think it's just one of the areas that we just don't focus enough on, right? Like even when we're
Mhm. Yeah,
I think now there's been a lot of pushing for healthcare, but often there's so much diabetes and hypertension
yeah.
and high cholesterol, and we kind of neglect oral
Excuse me.
health. So I think it's useful to have all of this and just the widespread impact of it
Hmm.
too. So
Definitely.
um,
And it's all connected. It's all connected.
yeah, it is
It's
absolutely.
yeah, it's genuinely all connected. Between your oral health, your systemic health, all, especially with you know, vascular diseases, cardiac diseases, diabetes, inflammatory diseases, all very much all like rheumatoid arthritis is a huge one as well. So that can, be impacted.
Yeah. Are you seeing a lot of issues in like children related to like with relation to children who've started who drink milk like later on once their teeth have come through, so kids that get teeth early as opposed to kids that get teeth later on and getting more issues with cavities, particularly with milk at night and things like that, drinking milk
So
at
definitely there's a term we use called baby bottle caries, where it's basically every single tooth has a cavity on it because, the baby goes to sleep, child goes to sleep, bottle in the mouth,
yeah.
and they just have that milk in their mouth the whole night, kind of putting an acidic attack on their enamel. And baby teeth exponentially decay faster than adult teeth because their pulps are so, juicy for the bacteria essentially. They're like so big. And they're essentially they're great for bacteria and they love them and they just eat right through them. So it is, yes. And also speaking of bottles, that kind of reminds me, please, if your baby's using a pacifier bottle, please stop by, 1 year. It causes, very bad airway issues, narrow palates, um, orthodontic issues that I've seen over and over again. So that's something I didn't mention in my presentation, but I should have. But thank you for reminding me about that. But yes, to answer your question.
There's another question too. Is it okay to brush immediately after a meal?
So great question. I so please wait 30 minutes after you eat to brush, as the sugar content in your mouth is very high. So the acidity is also very high. Which when you because but then when you brush, you're like eroding faster the enamel. So yeah, so wait 30 minutes. And also a little tidbit: eat some cheese. It kind of helps uh, neutralize that acid a bit
Oh,
on your teeth. So yeah, no, it's not okay to immediately brush after a meal. 30 minutes is fine though. No problem. I wanted to kind of emphasize the diabetes a lot as well, because I know we have a very high in our communities, a lot of people with diabetes. So
yeah.
it's something that I really hope those who have diabetes are getting, regular dental care. And if not, please do start.
Yeah, I
Maybe it's something the physician can take back to
yeah.
their patients.
It's a big issue, and I think also a lot of the problem, and I maybe not so much for the US, but certainly for Canada, and places like the UK where healthcare may be covered, but dental care usually isn't, and so that becomes a really big barrier because it's always so expensive, right?
Yeah.
And so often if you don't have insurance, you usually wait until you have problems, like
Yeah.
there's less incentive to go and
I,
get it checked as opposed to
yeah.
general health care. And so if it's not kind of understood how important it is, people are much more likely to say, actually, I'm just going to wait until I have an issue.
Yeah. And then more often than not, those issues end up being a lot more expensive than that checkup would have been,
Yeah,
or that filling would have been versus that root canal. So
yeah.
it's unfortunate, but
So just for everyone to know as well, this slides, the whole presentation is actually going to be on the YouTube, the SBMA YouTube page, so it will be accessible. So they will be able to have a look at the slides and go through it slower, and in their own time if they